You work in healthcare. You may be a doctor, nurse, administrative assistant, pharmacist, respiratory therapist, environmental services worker, epidemiologist, infection preventionist, transporter, security guard, procurement specialist, or any one of millions of essential healthcare workers in dozens of roles who make healthcare possible. Your role is challenging, but you give it your best because you know your job is important. Patients and their families rely on you. Your co-workers rely on you, and you take that responsibility seriously. You may work in a hospital, a primary care office, a surgery center, a blood bank, a radiology lab, or any number of places where you and your co-workers take care of patients, help their families, and support each other. Even if you don't have direct contact with a patient, your work supports patients. But no matter where you work, you know that sometimes things go wrong. And unfortunately, that happens more often in healthcare than we would like. In fact, studies have shown that in the United States, about 25% of people admitted to the hospital suffer from some kind of harm event. In primary and other outpatient care, that percentage is even higher. How does this happen? Some say it's because people make mistakes, but human factors engineers know that the answer is much more complicated. The reality is, healthcare facilities are complex work systems, and they don't always support safe and reliable work. However, there are things we can do to make healthcare safer, and those things begin with understanding healthcare is a complex system. Hello, I am a human factors engineer. A human factors engineer is a person who designs things to support people to do their work. A human factors engineer also knows how to make tools and technologies safe, usable, and useful. A human factors engineer also knows how to design work systems to support people. Think of healthcare as a work system, a complicated, elaborate work system. This video is about showing how healthcare is a very complex system and explaining how you can use that understanding to make your healthcare facility and work environment safer. Why is it important to understand that healthcare is a system? Because if you understand that healthcare is a system, you will better understand that errors can occur if something is poorly designed or used in an unintended way. Problems in one part of the system can create hazards in another part of the system. And if not discovered, problems in any part of the system could cause harm to a patient, you, or a coworker. When you understand that healthcare is a system, you will be able to see that problems are often more complicated than they first appear. But also, there are more ways to solve those problems. And you'll understand that you are critical to how well the healthcare system works, and that you have more power to affect how well your system works and improve safety in your healthcare facility than you might realize. In fact, you will understand that without you, it is very difficult for any healthcare facility to achieve total system safety. So let's talk about healthcare as a system and how to use systems thinking to make your hospital safer for you and your coworkers, and how to remove the barriers that keep you from performing your role effectively and efficiently. First, what is a system? The term system is applied to many things that are at very different levels of complexity. Computer systems, information technology systems, transportation systems, risk management systems. Human factors engineers think of healthcare as a socio-technical system. That means it has people and technology working together in an environment. You can think of it like this. There are 5 component parts that make up the internal environment of the healthcare system. First, a socio-technical system has people, not just patients and their families, but doctors, nurses, pharmacists, infection preventionists, laboratory technicians, nutritionists, facilities management, human resources staff, everyone. And all these people have particular knowledge, skills, and abilities that allow them to do their job. And all these people, being the humans we all are, can make mistakes. Second, there is the physical environment you work in. The patient rooms, hallways, store closets, laboratories, offices, operating rooms, and any other space where healthcare work is done. Third, there is the organization. Your facility's mission, vision, and values, the management structure, the policies, the hiring practices, the shift schedule, the health benefits for employees, and all the things that support the work you and others do. Fourth, there are tools and technologies that you use to do your work. It may be a robotic arm for surgery, a a computer, a UV light machine that disinfects rooms, an MRI machine, cleaners, a cell phone, a workstation on wheels, a crash cart, even sticky notes on your desk that you use as reminders. Fifth, there are tasks and processes that get performed. Everything from writing a prescription to drawing blood to sanitizing patient areas to finding qualified staff to work. There are millions of tasks and processes in healthcare. Then, outside of the internal environment is the external environment. That is, all the things people inside the internal environment can't control but have to account for. Things like state and federal regulations, supply chain problems, medical device recalls, medication shortages, and a whole lot of other things that affect work in healthcare. All these component parts, the people, physical environment, tools and technology, tasks and processes, organization, and external environment interact with each other. That means when something happens in one part of the system, it affects other parts of the system. There is something important to notice about this system. It's that the people, you, your coworkers, the patients, and the patient's family or caregiver are in the center. That's because other component parts of the system should be human-centered. That is, the system should be designed to support your work, the work that needs to be done to heal patients. You might be wondering, how does the way my workplace is designed affect how I work? Well, let's look at some examples. We can start with a piece of technology, the infusion pump. This is an infusion pump. Infusion pumps are often seen next to a patient's bed. It is connected to the patient and gives them medicine or food. Nurses program infusion pumps to deliver medicine or food at a rate and an amount of time prescribed. One day, a nurse programmed an infusion pump to give 20 micrograms of medicine over an hour. Instead of 20, she programmed 200. Some assumed the nurse was careless, but a closer look revealed that the infusion pump had a bad design. As the nurse was programming, she pressed the 0, but the 0 didn't show up on the display. The problem was that the pump didn't show the numbers on the display as quickly as the nurse entered them. But she didn't know that. The nurse thought the pump didn't record her button press and re-pressed the button, which resulted in an extra 0. This is a problem with the tool and technology part of the system. But what else was going on? Well, the nurse was very busy, as nurses usually are, and was trying to work quickly and efficiently. The nurse being very busy was an organizational problem, because the hospital didn't schedule enough nurses to work that day. It was an external environment problem because there was a shortage of nurses to hire, which also caused the hospital to be short-staffed. It was a physical environment problem because the nurse was trying to work across a large hospital floor and get to her next patient down the hall. There was a task and process problem because the method the hospital uses for buying infusion pumps didn't include a test for usability problems before buying the pump. There was an external environment problem that an infusion pump with a poor design was able to be sold on the market. There may be other things across the system that also contributed. You see that if we blamed the nurse and moved on, we wouldn't know that there were many elements or issues that led to this event. The nurse might be reprimanded and retrained to use the faulty infusion pump. This might work for that nurse, but what happens the next time when a different nurse is using the same infusion pump and has the same problem? Then another patient could be harmed, another nurse harmed. If we look at the problem from a systems perspective, we see that there are many issues to address if we really want to stop this type of problem from happening again. Let's talk about a more complicated system example. This is a place where people with kidney disease get dialysis treatments. When you walk in the building, there's a waiting room. Beyond the waiting room is a dialysis room with chairs, machines, technicians, nurses, and nurse managers working to help patients receive their dialysis treatment. Sometimes there are also physicians, physician's assistants, dietitians, environmental services workers, and other people who work to make it possible for patients with kidney disease to get their dialysis treatments. But something was wrong with this dialysis facility. Too many of the patients were getting infections and getting very sick. It was important to find out why. A team of human factors engineers went to the dialysis facility and did what is called a system analysis. They found that there were problems in many parts of the system that were leading to dialysis patients getting infections. In fact, when they looked across the system, they found 57 problems in the design of the dialysis center work system. Yes, 57. There were 5 challenges in the external environment, 8 challenges in the organization, 10 challenges in the physical environment, 6 challenges with tasks and processes, and 28 challenges that people were having while doing their work. There weren't problems with the design of the tools and technologies, but the tools and technologies could not compensate for the other problems. Let's look at one of these problems in more detail. The environmental services staff was supposed to clean the main dialysis room after each of the 3 dialysis shifts every day, but they were not cleaning as expected. This is a people issue. If you just stopped there and didn't investigate further, you might think, well, they need to be told to do a better job, or they should be retrained. But wait, the reason they didn't clean the room well after each shift was because the dialysis room was crowded and busy during shift change, the time they were assigned to be in the room to clean. There were people everywhere. There were patients in dialysis chairs, dialysis technicians taking patients off of dialysis and walking around to get supplies. There were people who needed to start dialysis in the room who were coming in to chat with other patients and staff. And there were nurses and nurse managers working with patients. Many of these people were putting their coats and purses and backpacks down, and without realizing it, keeping the environmental services staff from being able to clean between all of the people and their belongings in the time they had to clean the room. But what was there to do? Well, the human factors engineers talked to the environmental services workers and learned about the challenges that the environmental services workers faced. They heard, we can't get around to all of the people in the time we have to clean the room. And it is hard to clean when there are patients in the chairs and patients standing near the chairs waiting to sit down. And sometimes the patients coming in sit in a dialysis chair before we've had a chance to clean it. The human factors engineers knew that the environmental services workers knew how to do a good job and wanted to do a good job, but the system didn't support their work. But the human factors engineers had the power of a systems perspective and used that to come up with a plan. During their system analysis, they learned that there was an organizational policy to keep patients in the waiting room, but the waiting room was not being used. Instead, when patients arrived for their dialysis session, they walked straight into the dialysis room. There was a door between the waiting room and the dialysis room, but it wasn't locked and often left open. When asked about it, the dialysis staff said that they let patients in because they want to come into the room early to get onto dialysis early and also to talk with people they know. It made the patients happy, so the dialysis staff let them come in instead of waiting in the waiting room. The staff was trying to make the patients feel welcome. You can see that everyone was trying to do their best to do a good job. But when the dialysis staff understood why the environmental services staff couldn't get their jobs done, they decided it was best to keep patients in the waiting room until it was their turn to dialyze. When the patients understood that they needed to wait in the waiting room to reduce their chance of getting an infection, they were happy to do so. And guess what happened? The dialysis room had fewer people and was quieter after each shift. Along with some other changes, the environmental services staff was able to do such a good job of cleaning that infection rates went down. Patients and dialysis staff noticed how much cleaner the room looked. Other good things happened too. Dialysis technicians said, shift change is so much calmer, and there is more time to prepare for the next shift so I can get patients on dialysis more efficiently. And there are fewer distractions in the dialysis room. Even the patients noticed that the room was calmer and cleaner. You see, when there is a problem with someone not doing their job as expected, it is helpful to use systems thinking to understand why. Automatically assuming that the person needs more training or reprimanding loses sight of how complicated the healthcare system is. It is important to understand that in this example, what went wrong wasn't caused by one person's mistake. It was caused by several things that were not designed to support how people needed to work. If you recognize that healthcare is a complex system, you know that errors are not caused by one bad decision or action. Instead, errors are caused by interactions between the system component parts: people, tools and technology, tasks and processes, the physical environment, organizational policies, and even things outside the organization in the external environment. So what can you do? If you want your system to be safe and reliable for you, your co-workers, the patients, and their families or caregivers, you need to use systems thinking to understand your system when things go wrong, and ideally before things go wrong. First, remember that healthcare is a complex system that has component parts, and those parts work together. When something is not working well, first look to understand the causes from a systems perspective. Then, when you identify solutions, think about the potential solutions from a systems perspective. For example, say that you are a safety manager who wants to understand near-miss events that are happening in your system. But when you look at the number of reports you receive, you see that people rarely submit them. You might think that people just aren't willing to go to the computer to complete an event report. But what if you consider the problem from a systems perspective? Maybe there is a tool and technology problem, and the usability of the reporting system is so poor that a nurse doesn't want to use it. Maybe there is a task and process problem, and the respiratory therapist who tries to report the problem is asked for information that they don't have and isn't important to the report. Maybe there is a physical environment problem, like a dietitian sees a safety problem, but there are very few computer terminals that have the reporting software loaded, and they don't have time to walk to the other end of a large building to file a report. Or maybe there is an organizational problem, such as security personnel feeling that if they report a problem, they could get in trouble or be chastised because the safety culture of the healthcare facility has traditionally been unsupportive. A common organizational problem for event reporting is that people feel that it doesn't do any good to report because they never receive feedback that the reported issue was looked at and worked on. So when trying to find answers to problems, remembering that healthcare is a complex system can help you understand the problems and then find solutions that work. Second, recognize that no matter your role, you are an important part of the healthcare system, and your system needs you. If you see something that looks wrong, something that is a safety hazard or could lead to harm, don't think of it as someone else's problem. Think of it as your opportunity to address a weakness in your system. Don't be afraid to ask questions, raise awareness, say something to a coworker, your supervisor, or a manager in the department where you noticed the hazard. If your facility has an event reporting system, file a report. People are every socio-technical system's strongest, most adaptable, and most resilient component. And your healthcare system needs you to play your part in creating system safety. Third, if you are in charge of addressing problems, take a human-centered approach. The best solutions are developed when stakeholders have a voice, including frontline team members. So ask people from different jobs who are familiar with the problem to be involved in finding a solution. Say, for example, that you are working on a solution to address a problem with discharge instructions not being followed properly. You might be inclined to develop a new format for discharge instructions yourself, and then instruct nurses to follow the instructions. However, a better understanding of your system and the people involved could really improve your discharge instructions. What if you speak to nurses providing discharge instructions to ask about problems they encounter? What if you talk to patients and any supporting family members or caregivers after they receive their discharge instructions and ask them what is and isn't clear and how you can improve your instructions? What if you talk to readmitted patients to understand where they had trouble following discharge instructions? If you do this, you may find new and creative ways to help the nurses and the patients and families to better understand what they need to do. Maybe you can make instructions clearer or offer them additional resources if you know what their challenges are. Fourth, if you are asked to be involved in finding a solution, take advantage of the opportunity to represent healthcare workers in your role. When changes are made in a system, it is important for people in many different roles to let their voice be heard, so that the people coming up with the final solutions will understand the system impact of the change. Also, after a change has been made, if you believe it is creating an unintended new problem, you should speak up right away. So when you get asked to give your perspective on discharge summaries or hazard reports, or any number of other safety challenges faced in healthcare, be a part of the system that works for progress and positive change. Share your unique work experience and use systems thinking to develop solutions that work for everyone. Fifth, when something goes wrong, advocate for a systems approach to understanding the problem. If a person makes an error, remind yourself and others not to default to blame. Instead, try to understand the system weaknesses that contributed to the problem. After all, it's easy to assign blame, but it takes systems thinking to really understand a safety problem, and that understanding is needed to keep it from happening again. You can ask for help when you run into a really complex problem. Human factors engineers are here to partner with you and use our unique skills to identify and solve the system challenges that seem to keep coming back up or that you can't get a clear picture of. And finally, remember that when we rely on blame, we give up our power to create positive and meaningful safety change in the healthcare system for your team and for your patients. Well, now you know that healthcare is a complex socio-technical system. It has several component parts. In the internal environment, there is the physical environment, tasks and processes, tools and technology, organization, and the people, with you being an important and powerful part of those people. It also has an external environment with things you can't control, but have to account for. You also know that you can use your new systems thinking perspective to make your healthcare system safer for you, your coworkers, your patients, and their families or caregivers. Remember that healthcare is a complex system. Remember that you are an important part of your healthcare system. Take a human-centered approach to finding solutions. Speak up and represent healthcare workers in your role. Avoid blame. Your people want to deliver good care and do the right thing. Advocate for a systems approach to understanding problems and developing better sustainable solutions. Thanks for watching and listening. We hope you learned a bit about healthcare as a system, the important role you play every day, and how we can all work together to improve healthcare safety.